Today, I'm just going to show to you regarding the cervix. So this is a human cervix. It consists of an ectocervix and also an endocervix. But today, I'm just going to show to you the ectocervix. So in this field, you can see that ectocervix has a lining which goes along the way towards the inner part of the cervix. It is composed of stratified squamous epithelium. So you can see that there is some inflammation just beneath the epithelium that cause epithelium to become a little bit reactive. As you go along, you can see that this squamous epithelium has a few cells layer. The innermost towards the stroma is the basal layer, and just above it is the parabasals. And in between these parabasals and also the superficial layer, which is towards the lumen of the cervix, is the intermediate cells layer. Superficial layer is usually predominate during the early menstrual cycle. It is due to the effect of the estrogen, whereas the intermediate layer usually predominate in the late cycle under the effect of the progesterone. And both the intermediate and superficial layer can disappear or become lost in postmenopausal period. And the stroma of the cervix, the stroma is actually the part which made up of tissues underneath the epithelial lining. So it is composed of a fibrous tissue and also smooth muscle. And you can see there's also within this field there are few blood vessels within it. Under high power, you can see that it's formed by a wavy fibrous tissue which consists of fibrocytes and also fibroblasts. The fibrocyte has a very small and elongated nuclei, whereas the fibroblast has a little bit bigger and plumper nuclei. In this case also, you can see a few cystically dilated structure, and it is filled up with mucin. This is actually a Nabatean cyst, which are commonly found within the stroma of the cervix. Under high power, you can see the content of the cyst is actually a mucin. That is the pinkish color at the center of the cyst. The Nabatean cyst is usually lined by single layer of columnar or cuboidal cells, and sometimes when the cyst is large enough, this epithelial lining can become flattened. By that, thank you and have a nice day.